Cleveland Clinic, and I'm here today to present to you about midterm outcomes transcatheter aortic valve implantation in patients with small aortic annuli. So hopefully you can hear me well because there's a lot of voice going around. So there are a lot of factors in which the success of TAVI depends on. There are like the patient's risk assessment, and there are also technical factors about the procedure, and one of them are the anatomical features of the native aortic valve, and one of those features is the annulus size. Now, interestingly, the presentations that was supposed to be before me was talking about large annuli. I'll be talking to you about the small ones, so it would have been interesting to see how both of them correlate. So, about small annuli, it has been looked at before in the literature in a few studies, and they have mainly looked at the short-term outcomes, and they have provided mixed data regarding its clinical and hemodynamic finding. So that's why we performed this to assess long-term or the mid-term outcomes. So to execute this study, we actually included all patients who underwent TAVI at the Cleveland Clinic between 2017 and 2019 who had the Sabine 3 valve, because that's the commonly used valve at the Cleveland Clinic. And then we exclude patients who had valve in valve, we exclude patients with pure aortic regurgitation, we excluded patients who had self-expanding valves, and then we used a pre-TAVI contrast-enhanced CT scans to measure the aortic annulus, which was defined as the circumferential ring at the lowermost point of the aortic leaflets attachment. And for the primary outcomes, we assessed all-cause mortality and heart failure hospitalization, but we also looked at other secondary clinical outcomes and hemodynamic outcomes such as the gradients and structural valve deterioration, which is considered like a composite hemodynamic outcomes as per the VARC 3 recent criteria. So for our results, we had a total of 720 patients, 182 in the small annuli group and 538 in the medium annuli group. And both groups were similar in almost all baseline characteristics, except that there were more females in the small annuli group, which correlates with data from the Women International TAVI Registry at Mount Sinai. And also they had a higher STS risk score. So in terms of clinical endpoint, our adjusted Cox regression analysis, which we adjusted for the different factors and also prevalence factors, showed that there was no association, no significant difference between both groups in terms of all-cause mortality and heart failure hospitalization. And in fact, I believe that Kaplan-Meier shows the two lines were together, so there was no significant difference whatsoever between both of them. Same thing for heart failure hospitalization. Same thing we noticed for secondary outcomes like bleeding, stroke, conduction defects between both groups. The story for hemodynamic outcomes was quite different, as we noticed. So this figure we show here, of course, we noticed a significant increase after TAVI in both groups. However, then over the 3 years of follow-up, the smaller annular group had a consistent and significant elevation, significantly elevated both mean and peak pressure gradients until 3 years of follow-up. So that was actually quite significant. And they also had a higher risk of post-operative patient prosthesis mismatch. In terms of structural valve deterioration and moderate to severe regurgitation, they occurred in a low number of events, and so this finding, to be honest, is quite hypothesis generating, but they were also similar between both groups. So quite a few points on this. So the main takeout message is that while the gradients were higher in the smaller annular group, the clinical outcomes were not really significantly different. And it seems that the correlation between the gradients and the clinical outcomes seems to be a recurrent theme in this conference. And it actually, this phenomenon of discordance between them is actually quite interesting, and it's currently being investigated in the literature in the discordance trial at Mount Sinai and UPenn. The second thing I should note that these data only relate to Sabine 3 balloon expandable valves. We didn't include like self-expanding because that's not quite common at the Cleveland Clinic where I come from. And however, a previous study has suggested that self-expanding valves may actually be superior in small annuli, and this is now being investigated in the SMART trial. So the main message is that smaller annuli had higher gradients where clinical outcomes were similar, and if you are interested in reading more about this one, it will be published in a few days in the American Journal of Cardiology. Thank you so much.